Hi, in this video, I'm going to be talking about managing expenses related to your treatment that aren't necessarily due to the cost of care itself. For example, when you're going through breast cancer and its treatment, you may miss work for the days you get treatment, depending on how your employment situation is. There's also childcare expenses, parking expenses, all kinds of things that aren't covered by insurance that we don't tend to think of as medical costs. In medical economics, they're called indirect costs. So the time that you spend getting to appointments is the time you can't spend doing other things. And it would be naive of us not to bring these up and let you be prepared for them. The first thing I want to say is it's really important to be organized. So if you tend not to be an organized person, this might be the time to get a binder. These are things I've talked about in other videos too, to organize things that you have. Envelopes are really helpful if you think you're going to submit receipts to your insurance company. Some of these costs are covered by healthcare savings accounts or flexible spending accounts. Over-the-counter medications, for example, can be submitted for reimbursement for some people. If you have Medicare, they actually, depending on the plan that you have, you can buy some over-the-counter things and medical equipment that insurance doesn't generally pay for. So just staying really organized is really helpful. You can organize things by the month, you can organize them by the type of expense. Figure out what works for you. If you have a friend who's offered to help you during your treatment, this could be something, if they're really organized, they could help you with. It's not, taking you to appointments or providing hands-on medical care, but it's what we call instrumental support. They just kind of help you keep your act together. One thing that's really important to know is that at your treatment offices, they often have resources that they don't offer unless asked. If you think about it, your physicians are trying to take care of the medical aspects of your care, and you may not think to bring up the fact that they were running late means you're going to be paying more for parking. But they can validate parking in many places, so it's worth asking. You would think that we would offer things ahead of time, but it's often the case that what you didn't need at the beginning, you now could take advantage of, if that makes sense. So your needs are going to change. You maybe didn't think that this would be useful at the beginning, and now it is. So just ask. You can ask the receptionist, you can ask your nurse, you can ask the social worker and your physician, who, again, as a doctor, I can say we usually don't have parking validation stickers, but we can help facilitate you getting what you need. So it's really important. If you don't ask, you might not get. So ask for help and ask again. Is there anything people can do? The American Cancer Society, if you live in the US, has funds to support things like parking costs and gas. All your doctor needs to do is sign a form that you're getting care for cancer. It doesn't have to be breast cancer. So it's really important to know that these resources are available to you at the national level. Same with things like wigs. If you want to wear what we call on our prescription a full scalp prosthesis, which is a wig, we write a prescription. Your insurance will reimburse part of the cost. But there are also wig banks where people who spent a lot of money on their wig and no longer need it, they'll donate their wig, and you can get that without paying for it. Your social worker will be able to access resources like that. So it's funny to think about getting a wig that somebody donated, but if it fits and you like it, why not? These are beautiful. Why would they go to waste? So it's worth asking, and your team will be creative. You're not the first person to go through this, although your needs are certainly unique. You are a one-of-a-kind person, but we, see the same things over and over again. And nothing makes somebody happier than being able to meet one of your needs. You're not bothering us to ask. So, as we say, when you call with a question, if we can help, you've made our day. You're never bothering us. And if you get the sense that you are, just know that person might be having a bad day. Childcare, this is where your network comes in, even people you don't really know that well. When people say, let me know what I can do to help, giving them specific things they can do is actually a way you can help them, because they kind of don't know what they can do. And if this is somebody through your kids' school, they say, let me know what you need. You could say, would you be able to watch my kids on if I'm running late at one of my appointments at your kids' schools? There are probably other people who've gone through this. I cannot tell you the number of teachers who've been my patients, and they probably know other parents who would be able to watch your kids for a couple hours, especially if you have an end of day appointment because you picked that because of work and now you're running a little bit late. Things just got bogged down. In fact, today I came from a doctor's appointment and my doctor was running a little late. So it happens to all of us. And knowing that you've got people there who can help you when those unexpected things arise is really useful. I have to say, we need community. And you've done things for other people. Asking for people to do things for you, this is a really good time to build that request asking muscle, and know that one thing that really helps other people is helping you. So a lot of us don't want to be a burden, right? That's a big thing I hear from my patients. I just don't want to trouble people. But think about the time you helped somebody else and how much that helped you. So what goes around comes around. We all contribute to a meaningful, beloved community, and you're part of that. And it's time to ask for some help. I hope this has been helpful to you. Drop a comment or a question in our videos. I read all of those. We get back to you as soon as we can. If this has been useful, click like, because that helps other people just like you find this video. And don't forget to subscribe to our channel. We're always putting out new videos. You can follow us on Instagram. We just went up on Instagram. We have a blog. So lots of things we want to give you to help you feel supported during this really important time in your life.